We are the richest country in the world, but our nation's capital doesn't always reflect that. There is a great divide, and not just the political divide that's so often bandied about. We are now taking a closer look at a stark case study in the haves versus the have-nots. In the shadow of all that power, we find pockets of poverty, the areas COVID-19 seems to prey upon. Rachel Scott has more.
On the outskirts of the nation's capital, Washington, D.C.'s most vulnerable residents say they were suffering long before the coronavirus hit.
We are a tale of two cities. Welcome to Washington. It is the last colony or the last plantation, depending on your orientation.
In affluent areas where so many of the nation's policy and decision makers live, there are grocery stores, top medical doctors, and multiple testing sites available. But in the city's east, the disparities are stark.
We are just 7 miles away from the White House, but once you cross the Anacostia River, the socioeconomic conditions change dramatically. These are the poorest sections of D.C. They're more than 90% black, and they're being hit the hardest by COVID-19.
African Americans, the largest racial group in D.C., make up 46% of the population and 77% of all COVID-19 deaths in the district. People under siege by the pandemic, the poorest neighborhoods seeing the highest fatalities, Latinos having the highest rate of infections. Who lives and who dies from COVID-19 in Washington can be mapped by zip code. In these hotspots, residents are more likely to be low income and black, and least likely to have access to grocery stores. In Ward 8, there is just one major supermarket for more than 80,000 residents. In Ward 7, just 2. For Renika Bird, shopping for food has always been expensive and inconvenient. She now joins more than 38 million Americans who have filed for unemployment.
Between the actual transportation to get to the store, then the waiting in the line to get in the store, it's pretty much a half-a-day effort just to come to the grocery store.
But a few miles away, in the majority white and wealthier neighborhoods, there are dozens of supermarkets for roughly the same amount of residents. Grocery stores are built right under some apartment buildings. Poor and black communities plead for the same access.
Something needs to be done about it. And we shouldn't have to wait for a certain class of people to move into the community for it to be done. It should be done for us.
But hope is thin.
It makes you angry, and when we look at all the niceties, all the different stores, but it's just sightseeing for us. And that's the way we have to think. We have to always think about how much money we have to spend, always.
Beatrice Evans has lived here for 50 years and says she has seen little change.
We don't have internet in this building. We don't have computers. So that's where the information is coming. We don't get all that opportunity that's out there that D.C. government has, all the programs. It doesn't get over here because no one has a computer.
Her senior living center relies on the community's support.
I have a bad knee, and if I walk down, I can't buy much because how I'm going to lug it back. If I catch the bus, they done change the bus schedule. Everyone has to go onto the back of the bus, and crowding people together. That's not going to work for me.
Thank you. Okay. All right, take care.
Their lifeline is each other. Food drop-offs, mask giveaways.
Easy to go.
The Far East Collaborative passing out 1,000 meals a day. This attorney working 6 days a week to give seniors a hot meal.
The problem is actually easier for you to get a can of beer here than it is for you to get a fresh piece of fruit. We've been waiting decades for a hospital, health care, access to quality food. Those things go hand in hand.
Experts say the lack of access to quality food is costing lives, contributing to some of the underlying health conditions that leave poor Americans more vulnerable to COVID-19.
Our population, we have a lot of comorbidities that are high blood pressure, diabetes, cancer. Anytime you have any kind of comorbidity, that adds on to the level of care that you're going to need and receive. So the comorbidities increases the severity of the disease.
Healthcare workers at United Medical Center, the only hospital in Ward 8, say the lack of resources is delaying COVID treatment for patients in the area. The city has partnered with the private sector to attract businesses to Ward 7 and 8, but advocates say it comes at the cost of rising gentrification. Calls for better access to health care met with a solution when Mayor Muriel Bowser announced plans for 2 new hospitals in the area.
Is there anything that says this infrastructure should have been in place sooner, prior to the pandemic?
Well, I think that, yes, we all know that we need good building blocks of health and building an integrated health system. You don't get it with snapping your fingers. You get it with good, long, hard work and great partnerships.
But those hospitals aren't coming until 2023. Residents have been forced to cross the Anacostia River for testing and medical treatment at Howard University.
You said 40% of the patients you were seeing in Ward 1 were coming from these 2 areas.
That's correct.
What does that say about the lack of testing available?
Yeah, it says a lot about it. It says, one, that they're not necessarily being tested where they are, but it also says that they don't have access to health care. And the fact that they have to come over to us to be hospitalized or to visit our emergency room means that they don't have access.
Now the HBCU receiving private funding from Bank of America, stepping in to provide free testing for any local resident who wants it.
It may also save a whole lot of lives. You can't treat what you don't know you have.
But here in the nation's capital, some fear that even when the pandemic passes, the disparities will remain.
We're still like second-class citizens. The playing field is not level, never has been, look like it will be.
And that some of their neighbors across town won't pass the laws to help them.
They're not going to see this as an opportunity to improve health care, to improve healthy food access, to improve jobs, to make sure people are no longer living in poverty. They're going to use it as an opportunity to say, oh, well, those people are just going to have to die.
Rachel Scott for ABC News Live in Washington.
Our thanks to Rachel Scott for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.